this coronavirus story is changing. It's really changing. Let's take a look at the front page of The Australian tomorrow. And this headline, I think, will send chills down a lot of people's backs. Virus deadlier than it looks. And Jamie Walker writes that the man spearheading Australia's efforts to develop a vaccine for the coronavirus has warned that the contagion could become more deadly as it spreads. This is Trevor Drew. He's at the Australian Animal Health Laboratory. He's the director there, and China reported the number of infections had surged by nearly 2,000. Well, I brought you off the top tonight that it's actually up to 9,809. The death toll in China is 213. Now, this chartered Qantas Boeing 747 is due to leave Sydney on the weekend to evacuate Australian citizens from the lockdown city of Wuhan in central China to a quarantine centre on Christmas Island. Well, what we know now is that flight will go to Darwin because the 747 won't be able to land on Christmas Island, and they'll be taken then from Darwin. That's the story that we've got. They'll stay on Christmas Island for a fortnight to ensure they aren't infected. About 600 Australians are understood to be stranded in Wuhan, but only a quarter of them have registered to return home. Now, Melbourne's Monash University will delay the start of semester classes for a week due to the unprecedented situation of students and staff being unable to return home or return back in time from overseas. Orientation week will be postponed. Now, Professor Drew said early indications were that the disease was killing less than 2% of victims in China. And I think, Mike, that has sort of allayed a lot of people's fears, less than 2%, but he said that could be misleading because of the potential for it to evolve rapidly and gain potency. What are your thoughts on what we're reading in tomorrow's papers?
My thoughts are that I really wouldn't trust anything coming out of the ruling cabal that is Xi Jinping's government in China. There are conflicting stories from, well, the World Health Organization about whether they were quick off the mark, too slow off the mark, didn't want to discourage China from being honest about what was going on in future if we have something like this. Really, it's not easy to get a handle on it, but I was looking at, well, first of all, I noticed your comment, Jane, at the beginning, and looking at the Vox Pops there. I don't blame people for being suspicious. And as for us flying people from China here, if it's got a 14-day incubation period in which there are no symptoms and it can still be contagious, then what to do? If you want to come here via Qantas, do you somehow get ferried to Christmas Island, all expenses paid for a fortnight before you can go where you planned in the first place?
And there are questions around the flight crew too.
Indeed.
Because what happens to that flight crew who take the people out of Wuhan and take them to Darwin? Do they go into 14 days worth of quarantine? And what about the other Qantas flight crew? British Airways has stopped flying. So what about the other Qantas flight crew who are doing the regular trips to and from China? Look, I've heard from some people at Qantas, you know, off the record, that there is a little bit of disquiet. And when they see these front pages tomorrow, Claire, I think that they'll feel a little more unease, particularly when Professor Drew said that it's better to think of this emergent Wuhan strain as a cloud of closely matched pathogens rather than a single virus. His language is fascinating. He says it could rapidly mutate and become more deadly. He said you may well find more virulent viruses emerge from that cloud, because one of the things we know, Claire, is while the death toll seems relatively low, if that's the true death toll, it's contagious and it's spreading quickly.
Yeah, that's right. One of the things that I've seen covering the coronavirus for the last 2 weeks is just how rapidly the situation is changing in terms of what we know about the virus and how people are responding to that, how governments are responding to that. So all of these concerns are ever evolving, and we have obviously Qantas still flying in and out of China, but as are a number of other airlines, of course, around the world. British Airways was one of the first to say that they wouldn't take any more forward bookings while this virus was still being, I guess, assessed, and there's no clear proper response. In terms of what will happen to the crews who are on these planes. I do know that the crew that will go and collect the Australians who volunteer to leave Wuhan will be going with like it's called an OSMAT team. So these are the top of the top, Australia's best sort of health officials when it comes to dealing with these kinds of diseases. They deal with Ebola, Zika, all of those things. So one would imagine there'd be some fairly stringent health requirements put in place on that flight in particular. But as you say, on the normal commercial flights, it's just not possible to have that kind of resourcing. And it's definitely something that Qantas are going to have to keep a very close eye on.
Yeah, and I guess, you know, what's the threshold? Do we know what the threshold for Qantas will be, Mike? I mean, it would send an earth-shattering message to the Australian public if Qantas were to cancel flights in and out of China, wouldn't it? I wonder what their threshold is. If you know, I guess we liken Qantas and British Airways in a lot of ways. There are synergies there.
Well, the Yanks have done it. And, you know, the Americans do have a keen love of a dollar, and these are the accusations, of course, being made on talk radio today about Maurice Payne with the interview that she had with Alan Jones, that really it's commercial considerations over safety. But if the Americans are saying don't go there, and what have they described it as now? Condition red, or, you know, whatever. Anyway,
red alert.
Red alert.
Yeah, they've done a red alert.
Yeah, you bet. So really, I mean, this is serious, and I just go back to the idea that you cannot tell for a fortnight, apparently, whether somebody is contagious. So how do we deal with that then? Do we put everybody in quarantine no matter what for a fortnight? Or really, is it best, as one of your Vox Poppers said, because it's going to affect tourism anyway, to simply cease flying between here and China for a fortnight?
Yeah, and I thought that man was really interesting, Claire, because he said he's in the tourism industry. And I thought that was really an interesting take from him. Claire, how do you think it's been handled so far? You've been covering it for a couple of weeks.
Yeah, initially the government here in Australia was very slow to react with warnings. The US started screening people at their major airports more than 24 hours before we announced that we would be checking direct flights from Wuhan. On the day that Wuhan was closed was the last day that a direct flight flew from there to Sydney, which is obviously where a couple of, at least one patient was confirmed to have had the virus. The government significantly ramped up its response several days ago when it announced this Christmas Island plan, but there has been a lot of confusion and concern around that plan. A lot of people either not wanting to go to Christmas Island, not wanting to pay the $1,000 to be evacuated, as covered in these papers today actually. But then of course if they don't pay that money, they're signing on to an unknown amount of time staying in Wuhan. So it's definitely, because of I think the evolving nature of the disease, the government has been caught out playing catch up a few times.
Yeah, it has been, and Dan Tehan and the messages about education and keeping children from school and being critical of schools who said if you've been to China, stay home, and then having to backtrack on that. I know I've been on Talkback Radio and people are getting very mixed messages. Claire, I wanted to ask you, what happens, so Qantas, the 747 gets to Darwin, then how do they go from Darwin to Christmas Island? Do we know yet?
My understanding is that the plan is to use defence vehicles of some description. I'm not sure whether everyone will fit onto one, probably not if there's a lot of people that decide to evacuate, and they'll be then able to get to Christmas Island, and presumably it'll be defence aircraft that also take them away from Christmas Island to Perth once they've been cleared after that 2-week period, and then of course these people have to pay their own way home from there.
Yeah, right. There's another story. Charlie Peel's got it in the Australian tomorrow, and it's one of the stories that Claire was alluding to there, Mike. It says, faced with the choice of keeping his wife and young children in the coronavirus hotbed of Hubei province or boarding a $1,000 a head Qantas flight to Christmas Island, Hobart-based public servant Malcolm Scriber is resolute. The family is staying put in Wuhan. He doesn't want his family to spend hours on a plane that could be carrying virus-infected passengers, which takes me back to the Qantas flight crew. Alan Joyce was saying in the media yesterday that 50 people had put their hands up to volunteer for this. Gee, I hope they've got the right sort of hazmat material.
Yes, indeed. And of course, as you've already identified, a lot of Qantas crew staffers, from what I've been able to glean, are not happy with the way it's going. They have to go there in the first place, then they have to be on the aircraft with people whose condition, frankly, is not known. They have to deal with that. Yes, it's all very well for Mr. Joyce to say we've got 50 volunteers, fine, but then I guess that leaves a lot of people who didn't volunteer, and I don't blame them.
Yeah, and also I think there are going to be questions around, let's take a look at the Daily Telegraph as we talk about this. I think there are questions around not just the Wuhan flight. What I'm hearing from people who work there is just those flights in and out. And, you know, you can imagine if you were working on those planes, you'd have questions. Flying Kanga flu is your paper's front page tomorrow, Claire. Qantas keeps China flights as rival airlines ground jets. Airlines around the world have axed or cut back flights to China in the wake of the deadly coronavirus crisis, but Qantas has confirmed it will continue to fly into the country battling the infection. Claire, over to you.
Yeah, well, this was obviously going to be something that Qantas would have to deal with eventually, as soon as British Airways, as we discussed, decided they would not be flying between their major China centres and the UK. The concern here is obviously that with the rate at which this virus is spreading, that the more transit that you have, the more likelihood there is obviously going to be of bringing further cases to Australia. But I think what will be interesting, and perhaps the government is going to need to really step up here, is that the more the world cuts off China, and in particular the Hubei province, the more the rest of the world is going to really have to help, because if we are signing on to leave our citizens stuck there, then we need to have exit strategies for them. And as we've seen with this fraught plan with Christmas Island at the moment, you can understand why even commercially it's almost in the interest of the government to keep that transport going until they have more of an idea of what to do with our citizens that are over there.
Claire, do you know where the flight is taking off, that flight that goes to Hong Kong to get them out of Wuhan? Do you know where that's emanating from? Is that ex-Sydney?
I'm not entirely sure. I think it is obviously an Australian crew, so it would be one of the major airports here, yes.
We're just trying to find out. I've got some people from Qantas, can you believe it, Mike, asking me some questions as we're live on the air here, as they're seeing these front pages coming through. Death on 6 cities' streets. The Telegraph says China's coronavirus ground zero has started to resemble, Mike, a horror movie with dead bodies openly lying on Wuhan's deserted streets and people desperate to flee the usually bustling city, saying it feels like a nightmare. Mike.
Well, unfortunately, it's not just a nightmare. It's real. It's very real. But who is to blame here? What are you going to do? How much do you plan to risk if somebody is there on the street? I know we all say, yes, it's terrible, but who among us are going to say, OK, I'll walk forward and I'll be Mother Teresa and pick up this person and maybe get the virus? I don't know. I just don't see it happening like that. Look, I don't think the Chinese government's come out of this at all well. The WHO were...
What did you make of what... Yeah, I was going to say, what did you make of the WHO and all that sort of, I would say, pussyfooting around? It was really hard to listen to, wasn't it?
I think it was. And we heard, oh, look how quick off the mark they are. I thought, really, from the way I can see this has been going on for a little while. Now we have reactive management from the people in charge in China. This is after doctors were either arrested or threatened with arrest for saying it's really a lot worse than you've been told. And in the interest of good government, as the Chinese hierarchy put it, they were deleting social media postings about what was really going on. And the World Health Organization apparently thought they should be cautious. I mean, where's their duty here? Not to some future event in China where they're hoping for an honest reaction from China. Their duty surely is to the rest of the world and give their assessment, because we're relying on them for it, as soon as possible.